In our second video, we'll be diving into the software behind the scenes, Disect, which stands for Digital Imaging System for Enhanced Computer Tomography. It was developed jointly by Roger Rowland and David Heatley, and used by Professor Duncan Bell. Duncan will now take you through how it works, showcasing both human and insect examples.
What our software does is to show first of all the transverse view, which can be looked at either on its own or with the others. A transverse view, a sagittal view, or a coronal view. I think you can all make out the backbone and the sacrum and the liver and so on. We also could combine these in the form of various different 3D forms. So here is a view of the patient's abdomen. We can cut into this abdomen either from the front to the back, and as we cut in we're getting the low attenuation fat around the umbilicus. The attenuation isn't quite as low as that of air, it's not quite as black, and then if we cut in further, I think we're beginning to make out details of the liver, gallbladder, the bowel. This is showing up very white because this patient has been given the high attenuation barium sulfate. We can also see that this patient has had dye injected to bring out the blood vessels. So here we are looking from the front, looking from the side, looking from above. This is looking into the lower parts of the lungs and the diaphragm and heart and so on. The other thing that we can do, instead of just cutting at 90 degrees, we can rotate the cut, so we can actually cut in at any angle. And when we get on to looking at some of the insect scans, I think this is a very useful bit. But the other thing I would just like to point out is the value of the windows and levels. Now here in humans these days everything is so-called 12-bit data. In other words, it's 2 by 2 by 2 by 2, so a choice of 4,096 different shades of grey. Here we're looking at a particular window and level, which is that the radiologist has deemed the correct one to look at the particular structures of interest. But I'd just like to point out that by altering the levels and windows, one can either see more of the high attenuation structures or more of the low attenuation structures, and we'll be looking at this particularly with insects a little later on. So if I move that across, you can see we're seeing some of the muscles, the rectus muscles, and now as we cut through we're seeing some of the higher attenuation, like this patient's pelvis and the top of the hips and the ribs, etc. And if we go further across yet, we're just left with the bones. So here I'm going to be showing you a typical scan. In this case it's a locust, an adult locust, and you can see, just as we showed previously with the human samples, we've got the transverse view, the sagittal and the coronal view, and if we go on to Rome, wherever we look at in one set, it shows up nicely on the other. So on the left here we have the 3D view, and you can see the locus shyly peeping out of the straw, the plastic container in which it was scanned. The insect is still inside here. Normally we would take this data and put it into our editing program, which in our case is TomoMask, but there are plenty of others available, and remove the outside. But I thought in order that we can demonstrate some of the cutting features, we'll for the moment leave it inside the container. And what I thought I'd do from the start is have a look at this feature, the maximum intensity projection. Now what this is doing is it is a projection, so you've got to imagine that the X-rays are shining through the insect towards your eyes, and you have said all I want to see is the areas with the highest attenuation. And I remind you that white has a high attenuation, black has a low attenuation. And I think we can already see that there's obviously the head of the insect, its antennae, its compound eye, and you can see that its jaws, its mandibles are radio opaque. So if we go back to the volume view, we expand it up a little bit, and now if we go to the cut view, you'll remember that we can cut through from the side or above or from the front. You can also see that the insect is slightly to one side, so one might want to just rotate the cut a bit so that when you cut into the insect you're doing it at 90 degrees. So let's see if that's right. So I'm going to cut into the side now. And that's not too bad in that we're seeing the whole of the insect from the tip of its tail to its head. If we just get rid of that material, the other side, what is so much better is to have contrast both sides. If we left that bit in, we don't see as well. We'll be talking about this double cut thing later. So let's now look at a few features. We can see obviously many of the external features, but what I'd like to do is to cut into the middle of the insect and just see the differences in attenuation value. So we've taken off the cut plane. So what can we see? We've already pointed out the radio-opaque material in the mandibles. We haven't got nearly such a straight view now. So we'll just move that round a little bit. So these are the muscles, the adductor muscles, the powerful muscles that close the jaw. there's the brain. You can see the gut passing below the brain, above the subesophageal ganglion, and here is the bowel. If I go backwards and forwards a little bit, I think you'll be able to see these low attenuation areas, which are globules of low attenuation fat. The fat has a lower attenuation than, for instance, these large flight muscles, and these are the air sacs, which have roughly the same attenuation as the air outside. And we'll look at methods of delineating the air sacs and the air passages in a moment.